So good morning, everyone. 410 days later, we are officially into our 59th week, and thank goodness there was no one that passed away from COVID-19 over the weekend. We're still at 374 people that have lost loved ones through these difficult times. As of yesterday, 51.5% of Albany County's population has received at least the first dose of the vaccine. 37.8% have been fully vaccinated, which is good. Compare those to statewide first doses, the vaccine rate's at 41.1%. And the full vaccine rate's at 31.1%, which is good. One other thing we're noticing on a national level, 10% of people aren't going back for their second dose, which is alarming because they're afraid of the side effects. We're just trying to break that down, but it is alarming. So they take the first step, but they're not taking the second step for whatever reason, if you look at them numbers. So, again, we're trying to partner with everyone we can to get this vaccine out to people. And I want to thank Colony EMS. They were at Shaker High School Saturday, vaccinating Shaker and South Colony, students, their family, which was good. It's been a great partnership, but we need to get more students on board. And I'm going to get the video from Superintendent Core, who did a kind of like a vaccine thing with students within the school district that got it to encourage other kids in their schools to get it. So I guess it went out to the parents and to the kids. So I'm going to try to get a hold of that. Also on Saturday, we partnered with Jay Bertel from Crestwood Pharmacy to get students from Ravina, Queens, Selkirk School District vaccinated, which was good also. I also want to thank Jay for supplying the shots to provide 400 doses at the Hindu Temple Society in Colony yesterday, which was also a huge success. So Jay, thank you for what you're doing. And to everyone we're partnering with, to everyone out there that's still out on the front lines doing this day in, day out, thank you so much. To the Sheriff's Department, to the pharmacies, to everyone that's out there doing this. It's, listen, all hands on deck. Hate to give Navy a little credit here, but it is kind of like all hands on deck. And but one of the things we broke down and really looking at was the zip codes. Are we effectively hitting areas that this has affected the most, which is one of the things Dr. Whalen and I have always talked about. I talk about it in my office, and we try to figure out, we're doing everything we can. That's why we did the walk-up testing for these neighborhoods. We're really partnering with Whitney Young and other organizations to hit this. You have the Washington Armory. So you hope that all efforts, and we've been working with clergy, we've been working with legislators, common council members, everyone we can to get into the churches, to get into the neighborhoods. But I want to give you just a couple of examples of the difference in zip codes in Albany County. For example, if you look at 12159 zip code in Slingerlands, they have a vaccine rate of nearly 69%. They're almost at 70%. So good job there. If you look at 12211 zip code in Albany, they have a vaccine rate of 66.5, which is Loudonville area, Osborne Road in there. On the opposite end of the progress, you have zip code 12046, which is in Queens Hollow, and they have a vaccine rate of 19.2%. So you see the difference. If you look at 12206, zip code in Albany has a vaccine rate that's not much better, just under 27%. And unfortunately, many of the zip codes that are doing the worst in terms of vaccine rates are also the highest percent of non-white residents, the area that COVID-19 has affected the most. We still has the hesitation for the vaccine. We still need to get buy-in from the communities. So I'm pleading with everyone in these communities, please reach out to us if you have an idea for us to better get in there. We've gone to the American Legion Post, we've set up, stuff on the corner, Whitney Young. We need to get more people vaccinated, and we need your help. If you look at the zip code 12202, zip code in Albany has a population that's nearly 72% non-white, but the vaccine rate is as low as 31%. If you look at zip code, again, 12206, which is the lowest vaccine rate in the county, it has a population that is 67% non-white. And that's the lowest one we have in the county. So the targeting we did at Washington Armory, what we've been doing, what Dr. Whalen and I have discussed many times of trying to get out into the community, we need your help. We need your help, and we need you to convince people. We have the different challenges going on. We have the PSA commercials, TU, Times Union, Troy Record, Gazette. They've been running great articles. Altamont Enterprise running great articles on why to go out and get the vaccine. We need people to buy into it. Please, please, it's not gone. It's still here. It's still with us. I know that President Biden hit his mark, 100 days in office, of getting the vaccine out. He delivered on it, and now we have enough supply, or I should say, we have enough of the vaccine. We just don't have enough for the demand anymore. And I was hoping by the end of April that we would be close to 60%. I was hoping by end of May we'd be well over 70, and and we could really start to take a step back and try to get back into some normalcy. The problem is we are going to be taking a step back because we're not going to be doing clinics because we don't have people to take the shots, and it takes a lot of logistics, a time out of our staff, Department of Health, that still have other jobs to do, and Dr. Willen can talk about that. Still got amongst other things they're doing. This is just a little piece of the pie that they do at our health department. So again, please, I'm pleading with everyone out there, the clergy, to the members, school board members. Please help us, to the superintendents and the school boards and these schools. If you want to get these kids back, we need your help. We need you to educate them. We need you to get them to sign up. And we may be looking at doing smaller pods in the school district during the school day, but that means the logistics fall on the schools, that they have to have the parents sign off on this. They have to have the kids make sure the paperwork's filled out. And if that's an issue, we'll help fill it out, and we'll get partners to come in and help you do this. But again, this is the only way we're going to get through it. So about 52% of the U.S. population has been vaccinated at this point, and again, the supply will outpace demand soon, which we're there. Survey puts a number of those haven't been vaccinated, planning to get the vaccine. 62%, 17% are still saying they're still undecided what they're going to do. That's still a big number. So it's critical that we reach out to that 17% and continue to educate people, which we've been doing for the last 400 and some days. Continue to put this stuff out there and to getting people to please get involved with this. But I want to tell everyone, as of today, there's 23,719 cases of COVID-19 to date in our county. We have an increase of 39 positive cases since yesterday. The day before that, we saw 23. The day before that was 44. And these are some of the lowest numbers we've seen since October, which is good, which is really, really good. So please, but again, it's not done with us, and I don't want to see a little spike upwards. We don't want to see that. We want to continue to go in the right direction. I'm seeing more and more sports going on, more and more people getting out there. I know travel basketball's up running across, the East Coast again, and I also know that New Jersey won't let New York in to play any basketball tournaments because they were supposed to be there one in June, and they said New York's not allowed to play. So it is out there, and you see what happened to Tony Percenti out in Utica. Unfortunately, we got a young child that's doing really good at the hospital at Albany Med. I said that last week, and which is good. But again, it is still affecting people and putting them in the hospital. But over the last 5 days, the average has dropped down to 45.2 new positive cases each day. Yesterday it was 53. So again, going in the right direction. Over the new positive cases, 18 had close contact, 2 healthcare workers, 19 don't have a clear source. But Albany County 7-day average for percent positive rate is now 2.1%, which had declined from 3% just 10 days ago, which was starting to get alarming. To Dr. Well and I were seeing that number creep up, and now it's coming back down, so which is good. However, according to the latest data, only 24 tests were administered in one day. Capital Region is now at 1.6 for its 7-day average. The most recent daily percent positive for the region was based on only 99 tests administered, meaning COVID-19. We need people to go out and get tested. If you're not feeling well, please get tested. It helps with mapping and tracing this. It helps to know if the spread's still there. So, you want to get back to a normal world, you want to get back to open 100%, we need to know if it's spreading, and the only way we're going to do that is with testing. So I am encouraging people, please go out and get tested so we know if what we're doing is working. And if we're getting there, and the fact that a lot more people are getting vaccinated, or we're at that 50%, if it slowed the infection rate down. But we can only do that if you go out and get tested. There are currently now 434 active cases in Albany County. There are currently 1,130 people under mandatory quarantine, and yesterday that was 1,172. As of today, 23,285 people have tested positive for COVID-19 and have recovered. We have an increase of 250 recoveries since yesterday, which is awesome. Our hospitalization, 7 new overnight, and we are currently now at 35 people currently hospitalized from the virus. The day before that was 30. We were getting down into the 20s. We like that number. We like it to be no one in the hospital. Kind of creeped up a little bit there. We got to pay attention to that. And again, there are currently 4 patients currently in the ICU. Yesterday that was 4 too. But this is the highest it's been since March 7th. Just to let everyone know, since March 7th, this is the most amount of hospitalizations we had. So again, just following the data and the science to where it's at. So please, by all means, please continue to wear your mask, cough into your arm, clean your hands, stay 6 feet apart. We'll get through this. We are getting through this in a partnership by leaning on each other and working through this, and we'll continue to get through it by working through it. Please, everyone, just educate one another. Go to the CDC websites, go to the World Health, go to our Department of Health's website. There's good information up there. Please just, educate yourself and we'll get through it. On Friday, the CDC and the FDA lifted the 10-day pause on J&J, which is good. So they went through all the data. That's going to be reintroduced, and we will probably, and Dr. William will talk about it, more or less going to students this week with the J&J. It's college students, because that's where it was going initially, to get to 10 days so they're fully vaccinated and continue to move on. I know there's going to be a lot of questions on that from people that now that it's back. Please take the time to go to these 2 websites. They went through the study again. It's safe. It's back out. And you got to look at the effect that it had on a small population after 6.8 million vaccines went out, Dr. Whalen. So again, please educate yourself. So which is good that that's going to come back. And at the end of the day, the risk of COVID-19 itself is far, far worse than the vaccine itself. I mean, think about it. I mean, vaccine offsets the being sick and going to hospital. And like I said, even though people have recovered from COVID-19, a lot of people have a long road to recovery. They may be looking at lung transplants down the road, trying to get back to normal where they were pre-COVID. And I watched my brother struggling. He's out of the hospital on O2, lost over 100 pounds, and struggling every day to try to get back to where he was. And long road. And unfortunately, even though they have recovered, it's going to be a road for some of these people. So please keep them in mind as you go forward. And I just want to say to everyone that we need your help. And please help Dr. Whalen and our team to look at things differently, to get the vaccine out there. And if you haven't got your vaccine, please. It's one step to getting back to some type of normalcy the way we were over 59 weeks ago. But again, we're in this together. Be part of the solution, not part of the problem. Dr. Whalen.
Good morning. So we are continuing to focus our efforts on increasing the vaccination rates in Albany County. And as the county executive indicated, throughout the process of vaccinating the residents of Albany County, we have tried to do this with an equity lens, looking at our high-risk zip codes and strategies we could specifically use to ensure that the distribution of vaccine was equitable. As we get to the point now where we have more supply than we have demand, it's more important that we double down and look at those areas and look at additional strategies. Those additional strategies include education, and at the County Health Department, we presented last week to the Hub Equity Task Force the model that we have been utilizing with community health workers to go out and answer people's questions about COVID vaccination and then plan for vaccine efforts in those areas. And we find that, a lot of people still have a lot of questions, and it's important that people get answers to their questions so that they have a level of confidence with getting the vaccine. And we know there are still people that are sitting on the fence that are saying, well, I still have some questions and concerns. If you're in that group, I really would encourage you to get advice from a trusted health professional or from our health department, or online at our website, the New York State Department of Health's website, or the CDC website, to educate yourself on why you should be vaccinated. We talked about many reasons why vaccination is an important strategy for the past few months. And we talked about how vaccine is not just a strategy to protect yourself, but also to protect your loved ones and those that you may know that would be at risk of a worse course of illness. These are still very important strategies, but in addition, after our last press conference, someone helpfully put in comments to discuss variants, and I think that's a great suggestion. So variants, what does that mean? How does a virus normally behave? Well, a lot of viruses evolve and change and grow. And as viruses evolve and change and grow, there can be differences in how they are sequenced and even how they clinically present. But how does vaccination come into this? Right now, the vaccines that we all know took a lot of time, effort, and work to develop are against strains that we know. But as COVID evolves, spreads, and changes, there is always the danger that the longer it's around, the more likely that it could mutate. And this could result in us having a strain that would not be protected against the current vaccines. This is a risk that we know exists, and this is another reason why timely vaccination is important. If we can vaccinate up to 70% of our population, we can stop the spread. And when we stop the spread, we stop the chances for mutations. The last thing any of us want is for a strain to develop that would land us in essentially the same place we were a year ago, starting a new series of vaccinations. So people need to take that into consideration as well when they're making the decision to vaccinate. It is essential for us as a public health strategy to get herd immunity, for us to move forward and for us to go back to what we all want to do, which is life as we formerly knew it. There have been tremendous impacts, and you can play a role in reversing those impacts by becoming vaccinated. So that is something to think about. And I encourage everybody to ask trusted health providers and to look up more information on reputable evidence-based science sites. For those of you that have been vaccinated, you have done a great job for yourself and for the community at large. But I will ask today that you go a further step. Share with those that you know that may have questions or concerns your reasons behind being vaccinated. Particularly for our younger group, it's important for teens and 20-somethings to know why it's important for them to be vaccinated against COVID-19. This is something that you do to help yourself, you help your family, help your loved ones, and help all of us. So please give that strong consideration, and we're always available to answer questions whenever needed. We will continue our educational efforts, and we are going to continue to look at creative strategies to get vaccine out. We have worked with community partners throughout this to stand up pods in high needs areas, in areas where we know people feel more comfortable being vaccinated. We're working with providers to getting vaccine out to providers so that people can be vaccinated in their primary care doctor's offices. And all of these strategies, we hope, will increase our vaccination rates. It's going to take time and effort, and we need all of your help, as we have from the beginning. So, as the county executive indicated on Friday, the CDC decided to stop the pause on J&J. And we are putting some additional information on our website about this today, including a new fact sheet for patients and providers. The reason the pause was stopped is after very careful analysis, it was determined that the benefit by far outweighs the risk of this vaccine. J&J is an attractive vaccine for a lot of people because it is a single dose strategy. But we know that there is a very small risk of development of clots, and in particular, thrombosis with thrombocytopenia, which is not a normal clot. It means that there's clotting in the body with decrease in platelets. So when you get clotting, you normally give medicine that will decrease clotting, but in this particular situation, it has to be treated a slightly different way. And the low platelets that come with this syndrome are a little bit more dangerous. They're more dangerous than a regular clot. However, we know that this is a very, very small subset of people that have developed this side effect. And in the warning, they state that most cases of thrombosis with thrombocytopenia reported following Janssen COVID-19 vaccine have occurred in females age 18 through 49 years. At this point, we do have stores of J&J, and we will be partnering with local interested parties to get that out. We also have a lot of Pfizer vaccine. So in Albany County at the moment, J&J is by far not the only option. If you are more comfortable getting a Pfizer vaccine or a Moderna vaccine, there's a lot of Pfizer in the area, and there's a fair amount of Moderna as well. The Pfizer and Moderna, again, are developed utilizing mRNA technology, which is different than the Johnson & Johnson vaccine. These two vaccines do not have any reported side effects of thrombosis with thrombocytopenia. And the Pfizer vaccine, importantly, is the only vaccine currently that can be administered to 16 and 17-year-olds. We will continue to work with our partners and with the general public to increase our vaccine rates. And in the meantime, encourage all of you to assist us with that to your greatest ability. Thank you.
Thank you, Dr. Whalen, as always. And please encourage people to get it, and especially first responders. I had a guard this weekend, and I was talking to my brothers and sisters in the military, and there's still a lot of them that have not gotten the vaccine, and you're on the front line, and we've been in war for 20 years, believe it or not, longest war in history. And the National Guards and Reserves have been used more now in our whole history of this country these last 20 years. It's important to protect ourselves. It's important to make sure we protect the loved ones around us. But I do want to remind people, actually, Dr. Whalen, I'm going to throw you on the spot. I've gotten this question, and I'm kind of surprised I'm still getting it, is that people should realize, and I think you brought this up at the last press conference, even though you're fully vaccinated, you still can get COVID-19.
Right, so no vaccine is 100% effective against getting an illness. The current COVID vaccines that are on the market are about 95%, which is really good. But that means 5 people out of 100 that have been vaccinated that are exposed will still go on to get COVID. So this is another reason why the more people that you have that are vaccinated and immune will stop transmission. So even those 5% have much less likelihood of coming in contact with it because the vast majority of people are immune through immunization.
So I just want to remind everyone out there, it doesn't mean that you can just go out and not wear a mask and just do what you want to do what you used to do before COVID-19. So please be vigilant out there, continue to help everyone step in the right direction. We've been continuing our IGotMine challenge on Instagram, so please, still kids out there, go online. We'll show the better ones out there. We're continuing to try to get people energized about getting their shot and encouraging other people. So please, I hope you post a video or photo onto Instagram, explain why you got your vaccine. Encourage your friends, your families, others to do the same. We need your help. So please continue to do that and just get people behind it. If you want to go to the state website, their hotline number is 1-833-697-4829, and to see if you're eligible. I want to remind those that are over the age of 60 years old, they're now taking walk-in appointments at the Washington Armory, but you got to be over 60. I thought we pretty much opened up walk-ins all over the state, but I guess there's some confusion there that the Washington Armory is only 60 and above for walk-ins at this point in time. But you can still go to Cross Gates Mall to Lord and Taylor. I think I finally got that right. Lord and Taylor building there, and you can walk in at any time to get the vaccine. United Way number is still there to help people out, 211. They're still getting plenty of phone calls. People are still having a hard time navigating the state website. I wish they'd make it easier or do a pre-registration. I think that's a lot too. And I know I've heard back from some students because Whitney Young and like pharmacists, you do have to fill out with your health care. You do have to put the kid's social security number down. That's for billing purposes, but like Dr. Whalen said, and we still get this question, she said at the last press conference, you don't have to for our site or the state-run sites or Washington Armory. But these are small providers, the fabric of our community out there doing this, and the logistics and time is very timely. So again, please just understand that's why you have to give that information. And also go to our website, albanycounty.com. You can see about getting COVID-19 testings and everything else. We've said it enough. Please remember, our mental health support line is available 7 days a week, 8 a.m. to 5, 518-269-6634. Our 24-hour sexual assault hotline number, as always, 518-447-7716. Please continue to do the right thing, and we'll get through this and be safe out there.